Okay, Dr. Zainab. I will start timer for you. And when 2 minutes are left in your 14 minutes consultation, I will prompt you and
Mhm.
your timer starts now.
Okay. Hello there. I am one of the doctors in the. I am Dr. Salim, one of the doctors in the clinic today. May I confirm you are Mr. Ahmed, 48 years old?
Yes, doctor, I am the sister of Mr. Ahmed.
Okay, you are a sister. May I know your name, please?
You can call me Miss Iqbal.
Miss Iqbal. Okay. Okay, Miss Iqbal, I am here to discuss about to ask some questions regarding your brother's health condition, and at the same time, I would like to examine him. Would that be okay with you?
Okay.
Okay. Mrs. Iqbal, what brought Mr. Ahmed to the clinic today?
Yes, doctor, actually, my brother has been suffering from some redness in his eyes as well as some vision problem. So that's why we are here today.
Okay, Mrs. Iqbal, I'm very sorry to hear that. May I know from how long your brother is suffering from this condition?
Doctor, it is about 1 month ago. It has been there.
Okay, so the redness in the eye, it is started in both the eyes or it is in one eye?
Both eyes.
Okay, both the eyes. And was it sudden in onset or gradual?
Gradual.
Okay, and is it worsening with the passage of time?
Yes.
Okay, and is there any pain with the eye movements?
Yes, doctor. Not only with the eye movements, he always complains of pain.
Okay, and is there any itchiness or any discharge from his eyes?
No.
Okay, and may I know that how much it is affecting his vision?
Doctor, he always complains that there is some blurriness in his vision.
Okay, does he complain that he sees a double, or he just have only blurriness, or he sees double objects?
No, only blurring, no double objects.
Okay, and this blurriness started along with this red eye. I mean, since 1 month, is it the same duration?
Yes, yes, since 1 month.
Okay, and is it worsening also with the passage of time?
Yes.
Okay, okay. May I ask, is there anything which which make these complaints better? Any use of eye drops or any medication or anything which makes it better?
No, doctor, nothing.
Okay, and anything which makes it worse, bright light or anything which make these complaints worse?
No, nothing.
Nothing. Okay. Okay. May I ask some more question? Whether your brother is having a high body temperature?
No.
Okay. Does he have any lumps and bumps in the body?
No.
Okay. And is he experiencing any weight loss?
No.
Okay. And does he feel tired or he complain of tiredness
Yes,
since one
doctor.
month?
Yes,
Mm-hmm.
doctor. He complains that he is always tired. He experiences fatigue, lethargy. These complaints are there since last few months.
Since last, okay. May I exactly know how much time?
You can say 5 to 6 months.
Okay, 5 to 6 months. Okay. Have you noticed that he looks paler than before?
No.
Okay. And may I ask, does he have any does he have any weakness or any numbness or tingling sensation in his body?
No.
No. Okay. Does he complain of any headache?
No.
Okay. And is there any difficulty in swallowing with your brother?
No.
Okay. And is there any complaint of mouth ulcer, mouth soreness?
No.
Okay. Does he have complaint of any imbalance during walking?
No.
Any history of loss of consciousness anytime?
No.
Any history of fits or trauma to the head?
No.
Okay. Does he complain of any change in his bowel works?
No.
Okay. Does he have joint pain?
Yes, doctor. He has been complaining of pain in his right knee since last 3 weeks.
Okay. But you said to me that he don't have any high body temperature.
Yes, no temperatures.
Okay. The right knee pain is since how long? Sorry, can I
Three
ask you again?
3 weeks.
3 weeks. Okay. And before this right knee pain, does he complain of any other any pain in other joint?
No.
Okay. And this is still persisting, his right knee pain?
Yes.
And is it worsening with the passage of time?
Yes, doctor. You can say
Okay. Is there any stiffness in the morning? It,
N-
in this right knee? Does he
no.
feel any stiffness?
No.
No. Okay. Does the pain increases with activity or any other thing?
No, doctor. It is at rest as well as during activity.
As at rest and as well as during activity. Okay. Does he complain of any skin rash?
Yes, doctor. He has this kind of rash on his legs, and
Hmm.
they are there since last, you can say, 6 months.
Okay. Can you show me the rash?
Yes. Just give me a second. Hmm.
Okay. So may I ask that is does he complain of the any pain in his in these rashes?
Yes, doctor. These are painful.
Okay, painful rash. Okay. Does he have okay, these rashes are only on the legs or anywhere else in the body also?
Only on the legs.
Only on the legs. Okay. And you said that this is in 6 months, right?
Yes.
Okay. Does he have any change in his waterworks?
Yes, doctor. He is passing more waterworks than before.
Okay. Since how long he has this problem?
Since few months, 4 5 months.
Okay, 4 or 5 months. Okay. So is there increased amount or increased frequency of the waterwork?
Both amount as well as frequency.
Both. Okay. Does he complain of any cough?
Yes, he has cough,
Okay. Is it dry or wet cough?
dry.
Dry. Okay. And since how long?
Since 6 months.
Since 6 months. And does he have any shortness of breath?
Yes, doctor. It is also there.
Okay. When does he feel shortness of breath during exertion or is it a rest also?
No, only on exertion.
On exertion. Okay. And does he need extra pillows to sleep at night?
No,
Okay. And does he complain of any chest pain during breathing?
no,
Okay. And okay, no complaint of chest pain during breathing. Okay. Does he complain of any abdominal pain?
yes, doctor. He has some tummy pain.
Okay. Since how long?
Since 4 5 months.
Since 4 or 5 months. Okay. But you mentioned that there is no change in his bowel works, right?
Yeah, yes, doctor. Sometimes he complain of some constipation. Otherwise, it is okay.
Okay. Does he complain of any back pain or any other joint pain other than the knee? Any back pain?
No,
Okay. Does he ever tell you that he's passing stones in his waterworks?
no.
No. Okay. And okay. May I ask some personal question regarding your brother, if that's okay with you?
Okay.
Uh, does he smoke?
No,
Okay. What about alcohol?
no.
Okay. And Does he drive?
Yes, doctor.
Okay. And may I ask, does he have any long-term medical illness apart from this high blood sugar and high blood pressure?
Yes, doctor, only this problem since last four
Okay,
five years.
4 to 5 years. And does he take any any specific medication? Can you show me the list of his medications?
Yes, doctor, he takes lisinopril for high blood
Okay.
pressure, metformin,
Mhm.
and sitagliptin.
Okay. And from how for how long he is on these medications?
Almost 4 years.
4 years. Okay. And do he have any family history of any similar medical illness, high blood pressure, high sugar, or any other condition related to chest or joint?
Yes, doctor, my father has been suffering from lung scarring since last
Oh,
few years, and my mother was suffering from tuberculosis 2 years ago.
okay. Okay. Does your brother has any history of travel before these complaints started?
No.
Okay. Okay. May I ask your brother is married?
Yes.
Okay. And is he, sorry to ask personal question, is he sexually active?
Yes, doctor.
And does he have any, sorry to ask, does he have any casual partners?
No. I'm not
Okay.
at least aware.
Okay. Okay, Mrs. Iqbal. May I examine your brother if that would be okay with you?
Okay.
Okay, so I would start with the general look of the patient. How is he? Is he emaciated or there is does he looks sick or he is the general look of the patient?
It
Okay,
is normal,
then
doctor. Hmm.
normal. Okay, then I will go towards the hands of the patient. I will look for any clubbing, koilonychia, any leukonychia.
Nothing.
Okay, any increased sweating.
No.
Okay, I would like to know the uh,
It is
pulse of the.
regular. Two
Okay,
minutes are
and no.
left.
Okay, normal volume pulse.
Yes.
Okay, then I would like to check the proximal myopathy.
No, it is not present.
Okay, I would like to examine the eye. I would like to see the redness in the eye,
Yes,
and
doctor. They are
okay, and
present.
I will check the visual acuity and visual field.
Visual acuity, he can assess your finger by finger method. He can assess, although there is some blurring, and visual
Mhm.
field by assessing the extraocular movements. It is
Mhm.
normal.
Okay, and then I would like to check for anemia, jaundice. Then I would like to examine the mouth, and
Okay.
and then I would like to examine the chest. I would like to hear the breath sounds.
Hmm. Exactly where?
Breath sounds are normal.
Yes, normal. But there are fine
Okay,
crackles where you will be
okay.
more interested to find the crackles.
Apical zones, upper zones.
Yes, there are fine crepitations present in the upper zone, especially apex on both sides of the lung fields.
Okay, and I would also like to auscultate the heart for any murmur.
No murmur.
Okay, abdomen for visceromegaly
Hmm.
and tenderness and pedal edema.
They are not present. Only 10 seconds are left.
Okay, so may I ask what are your concern, Mrs. Iqbal?
Yes, doctor, what's going on with my brother? Time
Yes,
is
after
over.
taking yeah, okay.
Okay, so just tell me your positive findings in the history.
Okay, this is a 48-year-old male, Mr. Ahmed, and he has came with the complaint of blurring of vision and redness in the eye since 1 month. He is also known diabetic and hypertensive. Along with the redness in the eye, blurring of vision, he also complained of painful eye, and he also has history of extreme fatigue and tiredness since past 5 to 6 months. and he also complained of right knee joint pain since 3 weeks, and he has a skin rash, which looks like erythema nodosum since 6 months, and he has some symptoms of hypercalcemia, which he said that he has complained of abdominal pain, and sometimes he also have constipation and increased frequency of the urine. So these symptoms are there. Along with this, he also complains of dry cough and shortness of breath on exertion. He in past medical history is diabetic, hypertensive, and he is on lisinopril also, which can be contributing to the cough. However, there are this is one of the can be one of the factors contributing to his cough.
Okay, and your positive
And
findings in the examination?
yes, on positive findings, he has redness of the eye, and the visual acuity is not much reduced. He can see my fingers. Um, I would also like to do the fundoscopy, but I couldn't do because of the shortage of time. And apart from this, he has fine crackles in his upper zones, and there is no vastromegaly on abdominal examination, and he has this rash on his lower legs, which is looking like erythema nodosum.
Okay. And anything else which you want to examine in such patient?
I would like to do the detailed joint examination, which I wasn't able to do because of the shortage of time. Because he complained of right knee pain, so I would like to see is there any tenderness, any swelling of the joints, and any oh, I say any fluctuation in his joint. To look, I would like to look for the signs of inflammation in his right knee joint. I would also like to examine the back of the patient,
Okay.
and I would also like to do the lymph nodes.
Hmm. Okay, how will you investigate?
Um, I would first I will do the general investigation, CBC for and to look for anemia and white blood cell count, ESR CRP to rule out any inflammation. Um, then the renal function test, electrolytes, and liver function test. Then in the specific investigation, I would first do the ESR CRP. Then I will go for ANA levels and ANA levels, serum calcium levels, and serum calcium levels, ANA levels. Yes, chest X-ray and chest X-ray and HRCT scan of the chest, and the I would also like to do joint aspiration and to examine the joint fluid under microscopy.
Okay, one question I missed. What is your provisional diagnosis and differentials here?
Yes, my most probably, I think that this patient has sarcoidosis because of this multi-system involvement. However, it can it can also be one of the seronegative arthropathies.
Hmm.
Uh, this is my differential, and another I can also put. Yes, this is my differential sarcoidosis. I mean, maybe one of the seronegative arthropathies, maybe reactive arthritis or rheumatoid. Does not look like rheumatoid because of single joint involvement. So this is my differential.
How will you treat such patient?
The treatment involves non-pharmacological and pharmacological management. In non-pharmacological, I will do the education and counseling of the patient. I will involve the multidisciplinary team, which will involve the joint doctor, the eye doctor, and joint doctor, eye doctor, and also the chest doctor. And in the specific management, I would like to start the patient on the steroids, and I can also give this patient some steroid sparing drugs, immunosuppressants.
Okay, doctor, time is almost over.
Mhm.
Okay, Dr. Zainab, it is a good performance, I would say. You took a very good history. Just a few points which I need to tell you here is that you should try to manage your time. For example, here
Yes.
11 minutes history is not recommendable because you have
Mm.
14 minutes or 15 minutes, but consider it 14 minutes. Okay, so 14 minutes
Mm.
time, you can divide this time that you will take 6-minute history, 6-minute examination, and 2 minutes for concern. Concern management is very important, and these are basically the free marks which we can get in our PCs exam just by asking the
Mm.
concern and managing the concern in layman terminology. Okay, so here
Okay.
if you spend 11 minutes on the history, till 11 minutes you have completed only 4 marks out of the 28 marks of long clinical consultation. And
Mm.
so this is not basically liked by the examiner. I would suggest that to try to make your questions so much slick so that you can be
Mm.
able to at least that 6 minutes you can go towards 8 minutes, 6 to 8 minutes,
Okay.
maximum 9 minutes. 9 minutes are more than enough because you have to do the examination. Here it is multi-system involvement. You have to do all the examination. At least you have to touch the apart from peripheries general physical examination, you have to touch the chest as well as precordium as well as abdomen and the lower limb as well. So
Mm.
it will be only possible if you spare at least 5 minutes, or I would say even it is not possible to do all this in 5 minutes, at least 6 minutes.
Yes.
Okay, so
Okay.
this is something which I need to tell you. Otherwise, you have picked almost all the signs in the history, all the positive points of history, and your history was also, mashallah, very good, and it was structured, and it was there was no irrelevant question which you asked. Just make it a bit more fluent, more practice, so that you don't waste much time, and no need to confirm it. Okay, no, something like that, because it will save your time. Okay, otherwise your
Okay.
history was very good. Just a few points which I want to add here is that, for example, here when you are outside and you get this scenario that this patient, middle-aged patient, he has presented with blurring of vision and redness in the eyes. He is non-diabetic, hypertensive, and he has increased blood pressure, and his hypertension is uncontrolled a bit, and his diabetes is also uncontrolled a bit, as you can see in the HbA1c. No other information, and most of the time in exam you will just get one or two presenting complaint or one or two clue in the vitals and in the lab. So here the thing is that whenever you get such a presenting complaint, that is blurring of vision or redness of eyes, it means that you are dealing with red eye inside, or it
Yes.
can be anterior uveitis. Okay, so
Mm.
because anterior uveitis, most likely they will give you a case of anterior uveitis, they won't give you a case of conjunctivitis or simple eye infection. Okay, so you should know outside that what differentials I would make, what questions I would ask in the history. I would suggest you, there are some mnemonics which I made during my preparation, that for example, if it is a case of blurring of vision, redness of eyes, or painful red eye, you can make the mnemonic B star. B star, BI, STAR. B for Behçet disease, I for inflammatory bowel disease, S for sarcoidosis, T for tuberculosis, A for ankylosing spondylitis, that is seronegative spondyloarthropathies, R for reactive arthritis or Ritter syndrome. So you will be more focused that after OD para, I will jump towards these questions, and especially if the surrogate will tell you something else in the history, because the in basic exam, this is the beauty of that exam, that they will try to pass you, they will give you maximum information. When the surrogate is telling you that what's going on with my brother, it may be a possibility that he will tell you that yes, he has also come with the skin lesion or skin rash. It will give you a clue, but still the basis examiners want that you don't stick to one diagnosis, you should have a broad differential, and for that broad differential you should think that what other questions I should ask in order to rule out all other possible causes of red eye. Okay, so here when you start, yes, you started very well. You asked about the Odipara of this presenting complaint. After that, I would suggest that ask all the questions of this problem here, like maximum you have covered. Just a few things. For example, you can ask about any problem with the color vision. Okay, so that here not only the double VN but this color VN will also give you the clue that here there is involvement of optic nerve. If there is no such complaint, optic nerve is excluded. You can ask any flare or disperse of light which your brother complains, which can give you a clue that it can be cataract, although it is not there, but still these eye questions. Okay, when you asked about the pain, pain is always there or it is on the eye movement, or any gritty sensation in the eyes, itching of eyes, discharge of eyes. If it is positive, you can get the clue that it might be a case of conjunctivitis, which most likely is not the case in exam. Then you can ask about that, is there any discomfort in the eyes with bright light? I mean photophobia. If it is the complaint, then you can say that it can be a problem of anterior chamber. Here you can also ask that, for example, do you have any difficulty in seeing in the night, or any bumping into the objects, that whether it is a pituitary cause or any dark spots in your vision, which can give you a clue that it is a scotoma. Again, it can be because of the optic nerve involvement. Okay, after that you ask about the eye discharge. You can ask about nighttime vision. Otherwise, most of the questions you already covered. After that, yes, you asked about all the questions of CNS, because you don't know still that what system you are dealing with. For example, in the exam, if you come across such a presenting complaint that in initial after Odipara, you don't know what system you are dealing with, you can jump towards your general questions or constitutional symptoms. For example, here you asked about the weight loss. I would suggest, instead of asking a direct question of weight loss, you can ask any weight changes. Okay, so in weight changes, weight loss, weight gain, both will come. Whenever you are asking about weight changes, you should ask about appetite at the same time. Okay, after that you can ask about okay, one thing more. Whatever your presenting complaint is, you should ask any similar symptoms before as well, although it is not relevant in this case, but it will give you help in many other cases. For example, if it is a case of like multiple sclerosis, and here the patient has come with the weakness either in the form of paraplegia or in the form of hemiplegia, it will give you a clue that any similar symptoms before, then the candidate or surrogate will tell you that yes, it occurred before as well. So you will have your diagnosis in initial 2 minutes, even before start of examination, or especially in those cases where there is no spot diagnosis. For example, when you enter the room, you have to take the history from the surrogate. Still, I would advise that take a complete look on the patient from head to toe, because sometimes there is spot diagnosis there. But I would suggest don't restrict to your diagnosis. Just rule out all the possible differentials, or at least 2 to 3 main differentials relating to your presenting complaint. Okay, and after that, in general questions, not only weight change, weight loss, or lumps and bumps in the body, any feverish feeling, joint pain even comes in the constitutional symptoms. Because if you are not dealing with the rheumatology case, still you have to ask one question of rheumatology, one question of endocrinology, which are basically included in the general constitutional symptoms, like any weather preference, any joint pain, any skin rash, or skin pigmentation, or red spots anywhere on the body. It is good you asked about mouth sores. You can ask about sores in the private area. It can give you a clue that it might be a case of Behcet syndrome. Okay, and the night sweats, lumps and bumps, these are all question. Lethargy, fatigue, yes, you asked. So after that, you will ask about, for example, here you get the clue that this patient has, okay, one thing is red eye, anti-uveitis, one thing is erythema nodosum. Still, you have differentials, that in my differential which you make outside, it can be a case of sarcoidosis, or it can be a case of Behcet syndrome, because this Behcet also present with erythema nodosum. So here you will ask about other questions of your differentials. For example, here you asked about cough, you asked about shortness of breath, you asked about orthopnea. Even you can ask about the PND question, that is any nighttime awakening because of the shortness of breath, or any swelling of your lower extremities or feet. And um, chest pain, yes, you asked. You can ask about racing and pacing of heart, because there is also cardiac involvement, cardiac sarcoidosis. And even you can ask about the prominent veins. Okay, that is some extra question if you don't find any clue of cardiac problem. Apart from that, you asked about all the questions of neuro involvement, CNS involvement. Just one thing more. that, for example, if it is a case of sarcoidosis, apart from weakness or fits, there is facial palsy which is more prominent. So you can ask specifically any facial deviation to any site or any weakness of any part of the body. Yes, that you asked. You can even check for facial nerve in your examination. Okay, or for
Yeah.
example, if you miss anything during your examination, which is a very common thing, even the examiners will not mind. But one thing, that before start of your viva, you should offer this thing, that here the patient has complaint of red eyes, your presenting complaint is something related to the eyes. So before start of your viva, you should tell the examiner that in order to complete my examination, I would like to perform the fundoscopy of this patient and do the neurological examination in the form of facial nerve examination, or whatever the step. For example, you have missed knee examination, which was the presentation, which was the at least the symptom in this case. So just the things which you miss, you should offer. Otherwise
Okay.
they may write in your feedback. If you tell them that I want to examine them, they will just mark it, okay, yes, the candidate was interested in doing this examination. Just don't assume it yourself that yes, I know, but the examiners couldn't read your mind. Okay, one thing more, you should also check for parotid swelling, or you can ask this in the history as well. Apart from that, your history was good. In her past history, yes, you asked, you can even ask that this patient has this diabetes and hypertension since last 4 years. You can ask about the compliance or regular follow-up. In family history, you asked about, yes, they told you, they will give you some clues so that you can think about other things as well. Or you can even ask, when you were asking about travel history, that if it is positive, you can ask that where he traveled, or whether he had any contact with sick person or any TB patient, or is there any contact with active TB patient or treated patient, even when his mother was suffering from this problem. And it is very good that you ask about all the questions of hypercalcemia, which is very important in this case. After that, one thing which I noticed is that when the surrogate told you that my brother is a driver, here he has come with a blurring of vision. So it is a good thing that at that time you will manage this concern. Otherwise, you will not get time. That here you have to restrict the driving unless and until the things are sorted. For example, here when he told you, yes, he is a driver, you should answer this concern here, that I would advise him to stop driving at the moment unless his symptoms will sort out and we come out with a proper diagnosis. Until then, he shouldn't do any driving. Okay. So this was the things in
Yes.
the history. In your examination, if you spend much time on the history, you will not find much time in your examination. So it is best that you should spare at least 5 to 6 minutes for your examination. In the examination of okay, extremities, you didn't find anything. Uh, in examination of eyes, not only the visual acuity and visual field, in even you should check for the light reflex. I mean direct, indirect reflex. Okay, you perform a visual field examination. You should also check for extraocular muscle movements in the form of H movement, and you should also check for parotid swelling if there is any. You should also look for any deformity. I mean this nose lupus pernio, which can be present in this patient. Maybe although it is not so common, you should check the facial nerve. It will only cost you a few seconds. And after for example, auscultating the lungs for any fine crepitations at the upper zone or even in the lower zone, because his father has this lung scarring, you have to assess it yourself. Na examination, it will cost you 5 to 6 minutes, even more than that. You should assess whether these crepitations change their character on coughing or not, although it is a dry cough. And most of the time it is fibrosis like findings, but still you have to assess that whether the crepitations change their character on coughing or not. So it will cost you time. Even at that time, you should look for any cervical lymph nodes at least. And after that, coming towards the precordium examination, here the apex beat is more important apart from murmurs, and you should also look for raised venous pressures. Okay, and in abdomen, yes, you should look for any visceromegaly, joint examination, pedal edema, and leg swelling, leg this erythema nodosum. I just this thing. Okay, and in your differentials, apart from sarcoidosis, you can put tuberculosis, especially if you get the fine crepitations. You can put this even with dry cough. Okay, it because the examiners in case of PACES will not mind if you give them a good list of differentials which can be relevant to your case. Okay, so this was all about the history and examination. So I would suggest just try to manage your time. Your history taking is good. You should make some words more slick, more fluent, so that you can complete your history in at least 8 to 9 minutes. And after that, when you will stand up for the examination, then your other skills will be checked in the form of physical examination, identifying physical signs, and even maintaining patient welfare. Because this clinical judgment will come when you are answering the concerns and you are giving the viva, and your differentials will also be assessed when you are facing the examiner. So in investigations, I would suggest that whenever you are telling, okay, one thing more, yes, I told you before that before the start of viva, you will tell whatever you want to examine in such patient and you have missed because of shortage of time. Then in your when the examiner will tell you, okay, tell me your positive findings, whether he will ask positive findings in history, okay, you will tell positive findings in history. If he asks both, you can tell about examination as well. After that, you will ask about they will ask about differential. You should have at least good things which can favor your differentials. Okay, for example, here you can defend yourself that yes, this patient may have tuberculosis because his family history is positive, and even erythema nodosum can be present in such patients. But however, since the presenting complaint is not uh, relevant, so that's why it is down in my list of differential. Okay, and in investigations, whenever you are telling the investigations in your long clinical consultation, here, the examiner just does not want you to make a list of investigations. He also wants that what you would like to see in such patient investigations. For example, when you are telling about that I will perform the complete blood picture. Okay, one thing more, in your long clinical consultation viva, you can start from the general investigations. However, whenever you are appearing in any clinical medicine exam, whenever it is a short case, you should just tell the specific investigations. Never start from baseline, and especially who are giving the local exam, don't use this word baseline investigations. Always start from specific investigations when you are giving viva in short case, whether it is FCPS or it is MRCP. But it is if it is long case or long clinical consultation, you can start from the general investigations. You can say, yes, I would like to perform complete blood picture in such patient in order to look for anemia and specifically lymphopenia. I would like to perform inflammatory markers. They can be high, for example, ESR or C-reactive protein. I would perform a liver function test in order to look for raised ALT or alkaline phosphatase because of infiltration in case of sarcoidosis, which is my first differential. Even renal function test, I would like to go for serum calcium levels because it can be high in almost 30% of the patient. And in my case, I have find the clues in the history. Therefore, I would like to perform serum calcium. Then I would like to perform serum ACE levels, angiotensin converting enzyme level. Although they are not specific for sarcoidosis, but still they can give you a clue towards your differential. After that, you can say about urine complete examination in order to look for glycosuria or albuminuria because this patient has diabetes, hypertension, BSR, fasting glucose levels, or HbA1c. And after that, since your case also includes chest findings, here you will say that I will go for pulmonary function test because not only spirometry, other 6-minute walk test as well, because this patient also has shortness of breath. So in pulmonary function test or spirometry, you can get restrictive pattern. In chest x-ray, I would like to see pulmonary infiltrates or bilateral hilar lymphadenopathy. Please keep your mics mute. Okay, so a very important finding in sarcoidosis is in chest X-ray is bilateral hilar lymphadenopathy or pulmonary infiltrates in order to judge that what stage of sarcoidosis I am dealing with. After that, you can say that, yes, I would like to confirm my findings on high resolution CT scan. And in invasive investigations, for this case, I would go for transbronchial lung biopsy. Okay. And after that, you can say that, okay, in case if you find any cardiac symptoms or cardiac sarcoid, you can go for ECG, echocardiography, or even Holter monitoring for any arrhythmias. And just to rule out your other differentials, or for example, if you find hepatosplenomegaly, or even if you don't find, you can say that I will go for ultrasound abdomen pelvis in order to look for or confirm any hepatosplenomegaly, or even CT-KUB or X-ray in order to look for nephrolithiasis or nephrocalcinosis. And apart from that, for example, if you find any lymph node in such patient, you can go for lymph node excisional biopsy or FNAC. And just to rule out your other differentials, you can say that I would like to perform tuberculin test, gene expert, or interferon gamma release assay. Okay. And in your treatment, Dr. Zainab, are you listening?
Yes, yes.
Okay. So in your management, always start from non-pharmacological or general management and specific management. Here, not only patient education, counseling, explanation regarding the disease or multidisciplinary team involvement, you should also tell about, for example, here patient has eye symptoms, start from eye drops, refer to eye specialist, advise the patient sunglasses, advise the patient to avoid sunlight, and stop driving even if, for example, you haven't told the patient. Here you can tell the examiner, or you can also say that I will involve the multidisciplinary team. Yes, eye doctor. Even to the examiner, you can use this word: ophthalmologist, pulmonologist, radiologist. These all things which you don't talk with the patient while you were with the surrogate or with the patient. And after that, for example, here the patient has a right knee joint pain. You can involve the joint physiotherapy, and even vaccinations, influenza, pneumococcal vaccines, and um, I think this was all about general management. And after that, specific management. Yes, for example, if you have staged your disease on the basis of chest X-ray, that whether it is stage 0 disease or stage 4 disease, like sorry, stage 1 disease or stage 4 disease. For example, if you find only bilateral hilar lymphadenopathy, then it is stage 1. If it is bilateral hilar lymphadenopathy along with pulmonary infiltrates, it's stage 2. If it is only pulmonary infiltrates, then stage 3. And if there is only lung fibrosis, then it is stage 4. Your treatment, specific treatment will depend upon this staging. And even before start of steroids, you will tell your examiner that I must rule out tuberculosis because it may flare. These steroids may flare the tuberculosis if it is the case. Okay. And apart from this steroids, there are certain indications of steroids. For example, yes, here this patient is a candidate for steroids because he has presented with uveitis. He has presented with some lung involvement. So if in case his lung function tests are deteriorating, again he is a candidate of steroid. Here he has the symptoms of hypercalcemia, and if serum calcium comes out to be positive, again he is a candidate for steroids. Or in case if he has some neuro involvement or some cardiac involvement, neurosarcoidosis or cardiac sarcoidosis, again these are the 4 or 5 indications of steroids which are present in this case. Apart from that, you can also use the word pulmonary rehabilitation whenever you are facing any case in your pulmonology. Either it is pulmonology station you are performing, you all will get a station of pulmonology in your short case in MRCP PACES. You should use this term pulmonary rehabilitation whenever you are discussing the viva with the examiner, because this pulmonary rehabilitation will not only involve chest physiotherapy, but it has all the pulmonary vaccination as well as counseling and education regarding the use of steroids or regarding the use of inhalers. Okay. Just people, please stop your video because today I haven't made the settings. Okay. And apart from that, pulmonary rehabilitation, you should also tell about any antitussive therapy. Here patient has complaint of cough, and for example, if it is a case that patient has lung fibrosis, you can tell about antifibrotic agents in the form of pirfenidone, nintedanib, and even for the last resort, that is lung transplant. And yes, you told about steroids and steroid sparing agents. They also have a role in sarcoidosis in the form of azathioprine, methotrexate, even infliximab. And also, don't forget about the eye, which was your presenting complaint problem over here, that you will refer this patient to the eye specialist, and he may prescribe some topical steroids for his eye problem. And regarding his joint problem, you will involve the rheumatologist, and joint physiotherapy, hot compresses, even painkillers in the form of NSAIDs for joint problem. Okay. So this was all about this case. Since it is a multi-system disorder, whenever you are telling about what I will find in my transbronchial lung biopsy, you will find non-caseating granulomas. For example, this case will not only come with this presenting complaint, that is red eye, it can also come with presenting complaint of skin lesion in the form of erythema nodosum. In your description, you can ask whether they are painful, painless, are they tender to touch, I mean pain on touching. And in that case, you can ask about that whether this erythema nodosum has the property that it can resolve spontaneously. Okay, so if it is a presenting complaint is, I mean, erythema nodosum, here you have even a more broad list of differentials. Not only 4 5 differentials like of red eyes. Here, there you can think about sarcoidosis or any medication-induced erythema nodosum in the form of like streptomycin, sulfonamide, or even oral contraceptive pills, which are an important cause of erythema nodosum. Even streptococcal sore throat infection can cause this problem. Then again, tuberculosis, Behçet disease, inflammatory bowel disease, these are also important causes which will again be seen like with red eyes. And lymphoma in the form of non-Hodgkin lymphoma, it is also a cause of erythema nodosum. Okay, and here your case is like sarcoidosis. You can even ask about dry mouth, dry eyes, because there can be involvement of salivary glands or parotid gland. Okay, so this was all about today's case. Any questions you would like to ask?
Yes, I didn't get time to explain to the patient. So, in this case of multiple system involvement, how will we explain to the patient? Um,
Hmm.
the-
Yes, yes. Are you asking from
y-
me or you want to explain it yourself?
no, no, I'm asking from you, how will we explain to the patient
Okay,
that this is
okay.
a multi-system involvement?
Yes, you will explain it like this. For example, when the surrogate will ask you, they will, this concern will be asked in each consultation, that what's going on or what is the diagnosis. So here you will just come like you will explain in a layman terminology that yes, according to your narration and my examination, I have come to the point that your sister have been suffering from a condition which involves multiple organs of the body, because there is here I assess that there is soreness and swelling of different organs, mainly the eyes, lungs, and skin. And in this condition, basically the defensive system of your body has started working against the own body organs, but most of the time the exact cause is unknown. For this problem, we will perform certain blood tests as well as imaging and scans, and even some invasive investigations. And after that, we will come back to you, and we will also refer your brother to the eye doctor, lung doctor, joint doctor, as well as skin doctor, and we will try to help you in this regard. And for example, they will ask about more concern. Here most of the time one concern is what's going on, other concern is will you admit my brother. For example, there are certain cases in which you will admit, but here the presenting complaint feels like that you will not admit. But even I would suggest you that instead of giving the answer in the form of yes or no, it is better approach that you just come with a diplomatic approach. Instead of saying him, yes, we will admit you, or for example, here, we will not admit your brother, you can say that we will run some test on your brother in the form of blood test, imaging, and certain other tests. And after the results, I will be come back to you in a short time. Okay, so this is a diplomatic answer. And for example, here he can ask from you that is it a treatable condition. Here you can say that in most people don't need any treatment, but it depends or it varies from patient to patient. So as the condition goes away, because sometimes this condition can go away on its own, but it can take few months or few years. But we will first perform certain tests on you. We will also refer you to certain eye doctor, lung doctor, as well as joint doctor, and then we will be in a better position to answer this concern. Okay.
Mhm. Okay.
Okay. If anybody wants to ask any question, he can just raise his hand, or even he can write in the chat box. So I suppose there is no question. If there is no question, then I will just end this meeting. Thank you so much for joining. Stay blessed. All the best. Allah Hafiz.